Good evening, everyone, and welcome to, I think, the last Health and Overview Committee for some time, although I think we might not be. Yeah, it was hope. Thank you for coming. It's not a very nice evening outside, is it? The traffic's not good. And welcome to our visitors. It's really nice to see you face to face. Thank you. Right. Have we any apologies?
No.
Thank you. Any declarations of interest? No. Any public questions?
No questions.
This is the speed we're going, all right. Any town and parish questions?
No.
Any councillor questions? Right, item 51, primary care annual report. We have it in front of us. Sanjay, are you going to take this one, Sanjay?
Yeah.
Thank you. Thank you very much.
Thank you very much. So thank you very much for inviting us. So Sarah and I both work for Bob ICB within the primary care department. So we look after the GP side of primary care, but if there's any other questions around the other areas of primary care, we'll be happy to answer that. So within your pack, there's an annual report that we do every year for our local authorities, and we've put some of the data in there for you, just to have a look in terms of what's happening across the patch. And again, hopefully, oh, my mouse is just frozen, sorry. So, hang on. Good start, sorry.
I can talk through.
Yeah, go on.
So, so as Sanjay said, it's our annual report that we pull together, and we try to give you a summary of access and workforce in the main for our GP practices in the Wokingham area. And I can't get on the internet to be able to share it for our teams, I'm afraid. So, so if it's okay, I'll just talk through the individual parts in your pack you have. So the first area is around access and capacity. And in there, we have just provided you with some details of what percentage of Wokingham practices are seeing, or what percentage of patients within the Wokingham practices are seen within 2 weeks. So we have a target within the NHS to try and ensure that patients that need to see their GP practice are able to do so within 14 days. And the first data that we provided you shows you the breakdown for Wokingham. It actually shows that 89% of Wokingham patients were able to be seen by their GP practice within 2 weeks, which compares favourably with the national and regional positions. The next slide, as you go down, has access and capacity, and that shows you how many patients have been seen by their GP practice in Wokingham within the 2-week target period across the year. So it shows you that in Wokingham there's been consistency. I mean, what I would say is that 100% achievement of that target is probably unrealistic. Some patients will choose to be seen at a time outside of that 2-week window. So that, I don't think we'll ever get to a position where it's 100%, because patient choice applies in that as to when they want to be seen as well. The next slide will then shows you, it says appointment trends as the subtitle on the slide. And it shows you the GP appointments that how they've increased in 24-25. So it shows you a trend line. So you can see that a number of appointments have gone up, and you can see that there's a peak within December. So
is this and this is just for Wokingham? Yeah.
Yes, where we're able to, we provide it for Wokingham, but unfortunately some of our data we're unable to go down to local authority area. So some, unfortunately, we have to present at a Berkshire West level or at a Bob level where it's not possible. But this shows you the Wokingham data, and it has the green line at the top, which is the total appointments, and then underneath that, in this sort of light blue line, you can see then the number of face-to-face appointments that take place at GP practices, and then you can also see the number of telephone consultations that take place. And the data we're looking at this point shows that it's been a move to patients being seen more face-to-face, less on telephone. But we're talking a bit about new changes that there are for online consultations, which will, I think, in time change that position again. So moving on to the next slide, it shows you, sorry
if I'm interrupting you. There's a spike in October, both in the graph and in the table, which I presume is to do, beg pardon, pages 8 and 9.
which is slide, I think it's slide 4 in your slide deck.
So I'm looking at the numbers on the left-hand side. They're vertically set. So you have a spike in October.
Yes.
Both shown in the graph for face-to-face and in the table. These are not, I assume that that's affected by the number of vaccination appointments.
Yes.
So I don't see there is there is an increase in face-to-face appointments.
So there is a slight, the trend line, you can see it starts increasing again when you look at...
It's not back where it was in August 22.
Yeah, no, it's not at that level, I agree, but it has been increasing again.
So if you're including vaccination appointments, these are not appointments with GPs, these are just appointments at the practice?
It's all appointments in a GP practice, yes. They're not GP appointments alone, no.
Okay, and this is the only way you can present that information, you can't show GP appointments?
So we can we can see some national data that then shows us how many appointments are with a GP practice, with a GP themselves and with other healthcare providers. But I don't think it's presented in the pack in that way. But we can do some further work if you're interested in that data.
It was just I was slightly confused by on slide 4 or page 8, it does say GP appointments.
Yeah, no, you're right, it does.
Misleading then.
Yeah, no, apologies. Yeah, I believe that means GP practice appointments. Yeah.
So you'll be revising this when you're presenting it elsewhere?
So we can give you an updated pack, yes. Okay, so then the next slide then just breaks it down so you can see the number of appointments that are provided through the various modes of appointment there are across the different months in the year. And then what we're presenting to you here is saying that in March 25, 60% of appointments were face-to-face, indicating a return to in-person consultations, and 32% being telephone. But we also are then highlighting the fact that there is a move to more digital access and technologies to be able to support that. So all GP practices from the 1st of October of this year have to have online consultation tools in place within their surgeries. And that will mean that we'll start to see more patient needs addressed through that mode. And we might therefore start seeing changes in the data and there being less telephone, less face-to-face, because more are going to be done online. So we just wanted to highlight that to you. So,
when you say have to have online consultation technology in the surgery, are people supposed to come in and use that technology in the surgery?
no, all GP practices have the facility to have online consultation tools, but you will access them through, in the main, you will access them through going online. So using your household computer to be able to log on, or on your phone using the NHS app, you'll be able to go on, log on and fill in a form, which will then do an assessment of your need and help the practice to direct you to the right place to get that need addressed. However, what I would say, if people don't have the ability to use that digital solution, then they can still telephone their GP practice, they can still walk through the front door, and in those circumstances, then the staff within the practice will be supporting them to ensure that they access the systems in the same way to ensure parity is there. So you would be able to use the same tool by walking in the surgery, but most people will be logging on and accessing it
I do
that
have
way.
a concern with that, because those people without access to a smartphone or a computer are then having to compete on the telephone with all the people who are ringing up saying, I've got an emergency, I need an appointment today. It really disadvantages them to they're back in the 8 o'clock scramble to try to get trying to get through, let alone get an appointment.
So what practices are starting to tell us is that because online consultation tools are being used more and more, that is taking away that 8 a.m. rush on the phones, and therefore people that are having to use the phones because they're unable to use the digital solutions are probably finding that access route is better as a result.
And I think probably in addition to that, if the query is sent via the online consultation, it might be, could you tell me if I need to double up my medication? The doctor will respond back via email or whatever. So it won't take up an appointment as such. It's just another mode of communication.
Alice, can you go next, please?
Hi, can you hear me? I can't see anything at all at the moment. So, thank you, Chair. My question is, Sarah, how are the public informed about this new change?
So the GP practices themselves, Alice, in the main, have been communicating with their patients and with their patient participation groups.
Just to share with you that, so we are just, that we are just doing our NHS app, and we've been talking to the public as such, and they don't know about this new change. So I do encourage that there's more communication needs to be going out. We are making assumptions that this is communicated by the surgeries. We need more communication out there about the new change.
Yeah, fair comment, Alice. We'll work with our comms team about how we can improve that position.
Thank you. Thank you, Chair.
Sorry, at the Health and Wellbeing Board, they actually announced that they were doing a consultation, actually trying to reach out to groups that were unable to access digital technology. Now, this seems all a bit the wrong way round. So why is this being brought forward without actually looking properly about what the facilities will be for those people that can't access it? Because I know for a fact I support an elderly lady who's in her 80s. She is never, ever going to be able to use this. And the stupid thing was, sorry, I shouldn't say stupid, frustrating thing was the questionnaire that was being sent out was digital. Mm-hmm. So how was that actually going to reach the people that can't access digital? So when are you saying this is actually happening from?
It happened from the 1st of October. It's a national change.
But I can tell you now, my GP surgery has not communicated it with me. I am digitally able to use. I would prefer to book an appointment online. So I've had no communication from my GP, and I would say Finchampstead surgery is one of the best surgeries in Woking. I don't know anything about this. So this all seems to be, you're announcing this here and telling us it's happening, but I genuinely don't think this is actually coming through on the ground, because I rang and made an appointment with my GP. Yeah. I just think there's a lot of things that need to be done before this is rolled out, and there could be some incredibly vulnerable residents that are going to be in big trouble because of this. Sorry, I feel quite frustrated by it.
So how I would respond to that, so it is a national change, so it's, it's not something that we've done locally. I would say that there has been preparation leading up to this, in that nationally there's been funding available to PCNs to work with their practices that form their PCN to get to the position where they're able to implement. So I would say a lot of the need to put things in place they should have been driven through the PCN arrangements. But I hear what you're saying around communication, and we will take that forward and on board.
I just come back on, what are you actually going to do about those people that cannot access technology? And there will be, and unfortunately, those people are often the people that have the worst health outcomes and who need the support. And we're going to be missing out on a key group of people here.
Yeah, I can completely understand that. So we do a programme of practice visits to all the practices across the ICB area, so right across Bob. And one of the key things that we're doing in those discussions with practices when it comes to online consultation is to check that there is not just this one route in, that people still have got to have equal access, whether they're telephoning the practice, going online or walking through the front door. So we expect reasonable adjustments to be made to ensure that nobody is disadvantaged.
And it will never be 100%. Just there's never an aim to move to 100% online.
To labour the point a bit, it's just that you said, they will be helped to then use the facilities that way. I can tell you now, the lady that I support will never, ever be able to use digital services.
Let me clarify what I meant by that. So if I walked into the GP practice today, weren't able to use the technology, the reception staff, the care coordinators within the practice will be completing a proxy form on my behalf. So they will be asking me sufficient questions to be able to ensure that I get the right appointment with the right care professional in the right time.
Yes. Thank you. Earlier on, you said that someone can go online and there'll be a form. And are you saying there'll be an answer at that time or later on or the next day? What is that?
So you complete the form, and that will then be, depending on it will vary from practice to practice depending on what system they're using. But a GP will then, somebody in the practice will then look at it and decide what needs to happen. Or there's an algorithm that helps decide what will happen, and you will be told within 24 hours what is the next. They either say, we got you an appointment, this is when your appointment is, or you can go to the pharmacy, the community pharmacy should be able to help you, but 24 hours.
And this is for non-urgent. So obviously, if it's for non-urgent,
my GP surgery in Lower Early uses Anima, and that was a huge, big rollout. Is this replacing Anima then?
So Anima is a online consultation tool. So it'd be for the practice to decide if they still want to use Anima. They probably will. And Anima is, we would say if a practice is using Anima, it's perfectly acceptable for them to use that system.
Yeah, because I think it works very well, actually.
Good, nice to hear.
In the NHS app for my surgery, the only kinds of appointment I can book are a B12 injection, a pharmacist phone call, or a smear test. So...
Yeah. We would need to look into that further. Yeah.
And I have to say, I did book for a smear test using the app, and I put notes on there asking if I could have a call moved at the same time. And I booked a long way in advance. And when I attended the appointment and asked the nurse, she said, "Oh, we don't read what you put on those forms. We're far too busy, So, I think there is some breakdown going on with using the online system. I'd love to be able to book online, rather than try and ring, because at 8 o'clock in the morning I'm normally driving to work, and then I'm at work during the day. It's a fantastic concept. And I have to say, about 20 years ago, it was working really well at the surgery I used in Reading, and it seems to have not worked. It seems to have fallen apart since then.
I'm not the best technically on these things, so I can honestly say that I probably sorry, that's my phone. I should have put it on. So
I think just to pick up, I mean, we can maybe take your practice name and we can have a look for you as well, actually.
Yeah.
But there should be somewhere on there that says online consultations, online, and you need to go through that bit. I'll have a look at Finch Hampstead while you're
yeah, because they might not be able to put so much on the NHS app offer because they need people to go through the online consultation tool and then they organise. So yeah, so the fact that you can book. Well, they are, but not through the online consultation tool that they're using. And then obviously on the NHS app, what they're having to do is put the routine.
Were you suggesting perhaps my surgery has a different route that I'm completely unaware of because they never told me about? I think you mentioned something that I didn't know about, and I don't know about that.
Yeah, Anima is an online consultation tool. Every practice, there are numerous tools out there that they can use. So, and GP practices are independent contractors, so we can't make them all use the same tool, but the concept of all these tools are the same. It's that everybody, whether it's in a proxy way or themselves, complete the tool, and then that allows them to triage patients in the most appropriate way.
But we really need this to be completely joined up. So when you go on the NHS app, which I use, I should be able to see, and it tells me online appointments. It should tell me, direct me to whatever the service is that my GP's using, shouldn't it?
As I said, not that technically able to answer the question, but
the principle of that.
In theory, yes, but it's obviously not working for you, is it? So there must be a reason why it isn't, and we would have to investigate that.
Okay, thank you.
We're not getting very far, so I just wanted to make a point that both Alison and Jackie said that they had no knowledge. Brookside Practice, which is in early, have used Anima for quite some time, maybe 2 years. Prior to October, there was a limit to the number of consultations through Anima they would allow. So quite often you couldn't do anything until 7 o'clock the following morning. That stopped now. And they did make sure that all patients were informed of that change, which is that change coinciding with the October requirement. I wanted to go back to something you said about, somebody who's digitally excluded, well, they can go into the surgery and a member of staff will help them complete the consultation on a proxy form. I have a concern because I don't see my surgery making any allowance for that. The only way you could do that is actually dealing with the reception staff at the counter. Somebody who's a bit hard of hearing, which often people digitally excluded are also hard of hearing, usually age-related deafness, they're going to be bellowing all about their personal symptoms to somebody the other side of the glass pane, trying to scribble it all down. The rest of the waiting is going to hear what's going on. That is not dignity. That is not really an acceptable solution, in my personal opinion. I do think there seems to be a massive galloping towards digitisation of every service. This has come up in other areas as well, and it's leaving behind the digitally excluded, particularly the elderly, that are not as computer savvy. So I really think this needs thinking about more carefully.
So I'm not as I said, we're working with practices to make sure that there are reasonable adjustments made, and happy to pick up with Brookside Group Practice the fact that, this is being conducted in an open environment. And I'm not saying it is, but right.
I'm not saying that is the case, but I don't see any. Yeah, sure. I don't see any arrangements to allow people, and I was in the queue the other day and there was a really long conversation going on with somebody at the window, which was presumably somebody trying to sort out this consultation process. So
yeah, So we'll happily give a message out to the practice to make sure they recognise the the sensitivity of some of those conversations, and then to be managed appropriately. So we can do a message in our GP bulletin.
Thank you. Nagy.
Thank you both for presenting this report. I mean, we see a lot of presentations like this in this committee. Every time they appear to be telling some sort of nice story, but I think the ground reality is entirely different. Same with these slides as well. With the patient experience or patient survey, it currently sits at 75 or 77. Okay, at least for the Wokingham area, and I don't think that is true. When we speak to a lot of residents, and I think all the other councillors will echo my concern as well, they are struggling to find appointments. Okay, this online thing might help, but not for everybody. And the comms has been very poor, because just last week, my wife wanted to get an appointment. She's been waiting on the line for at least 40 minutes. Okay, then when she got through the line after 40 minutes, okay, she's been told she needs to do an online form.
Yeah.
Okay, and then she has to wait for a response for half day to come in. Okay, it would have been easier for someone to say if she gets one or not, rather than her waiting all day. Okay, and then the message says she has to go to Royal Parks in another couple of hours' time. Okay, and when we are registering for a GP, you need us to be somewhere near the GP or within the GP's catchment, you call it. But when we need an appointment, we've been sent to Royal Berks, which is about 9 miles away, or we've been sent to Reading, which is the urgent care unit, or Bracknell. I think for those that have cars, it's fine. But I think, again, if there's elderly or others who can't have access to this, I think it is a nightmare. Okay, and this has been going on for quite some time, and I don't see any improvement happening in this area.
Yep.
And with the growing population within the Wokingham borough, I don't think any of these practices will have a positive impact. So, yeah, what measures can you do?
So if you can share with me the practice concerned, I can raise it and discuss it with them. So, you know, all practices do have processes for patients and patient representatives to give feedback and raise concerns so that they're able to take them into account and address them. But yeah, I would need to speak to the practice concerned.
Sorry, Beth, it's going to take some time, don't mind. And the data which you're presenting in terms of the appointments, it's going back to Feb, and now we are nearly in 2026. Yeah, I think we need
this
more.
This is our 24-25 report that we've been invited to present.
I don't think that reflects the right stuff
the
as
precision
well.
Is, it's old data. That's what we've been asked to present. Yeah.
Okay.
Thank you, Naomi. Please. And then Adrian. Alice, did you hear?
I can't hear, but I'm assuming that I could ask the question, Chair.
Yes,
Is that
please.
Right?
Yes, please.
I mean, Sarah, I think this has been very, very difficult for you kind of thing, because you're having to answer things that it is out of your hands, because it's what the practice are saying. But there is so much inconsistency that makes people confused. And I think there needs to be some sort of, not every surgery is doing the same method of communicating or doing training for the NHS app. So I have asked surgeries, and you know this, to find to help them have the cohorts to be trained, because that is something that, because a lot of the clients are asking to be shown how to do the NHS app, and we've been told that the only way the surgeries can do that is by a group training, which will not work for everybody. So there has got to be an individual training looked at for specific people who have literacy issues. You know, and that is one of the things that we are having a lot of people turning around and saying, I'm not using digital because I cannot use it because I don't know how to use it. Nobody's helping me. So I do think you need to go back and turn around and say to the surgery, somehow get a digital cafes set up on a regular basis.
Yeah. And we do have a lead within the ICB for the NHS app that is working with us around whether there is more that they can do around digital cafes. And she's speaking with the GP practice on an information sharing webinar, which I don't think it's not going to be until January, I'm afraid, though. So, yeah, I mean, we continue to work with you, Alice, with Health Watch to try and improve this position. I think we need to do more work with the PCNs for them to try and see how they can be more coordinated in their approach as a group of practice. But you unfortunately, and I know it sounds really negative, but we can't enforce how they operate.
I know. I mean, I think that's where the problem is because of the independent contract. But also that is also something that needs to be communicated out to the public because according to the public, all the surgeries work the same. And that's one of the things that doesn't happen. And it is not communicated to them that the surgeries are independent contracted. So, you know, please, I really think there is a need to make this clear. But also this NHS, the digital platform that's taking place is not making it easier for people. We've also had people to turn around and say, oh, the GP says they will ring us, but they don't give us a specific time. I cannot just simply drop my work and take a doctor's call. That cannot happen because I'm in the middle of teaching. So I do think there's got to be something that needs to be looked at about specific times be given to people that they will be called.
Yeah. If we can work together, Alice, on engaging with our practices on issues like that, it would be appreciated.
Yep, thank you. Thank you.
Can we make this the last one and then we can move on to the next page?
Yeah, thanks for coming. I've been asking the same question for about 6 years. Basically, Woking was a small place and was scheduled to have big estates built around it. And my question was, what's the capacity of modality and how will it change when those big estates are built? A load of those estates are now built. Modality is, I believe, has gone from maybe 10,000 to 25,000 people registered there. I'm not sure exactly. These reports, I would like to see how many registered residents there are for each practice. Now, we believe it's been overwhelmed for pretty much all of the time since it was opened. Now we are going to have hundreds of houses built south of what's called the Southwest Distributor Road, which means that there will be hundreds more houses and the closest doctor's GP surgery will be modality. Planning permission was agreed but under appeal for a site with 350 houses just off Evidence Lane. Another site is going to appeal just over the road from that, which is about 100 houses. On top of all that, we will be building in addition to that. So modality we'll be looking at a town which is 3 times as big as it was when it was opened. And there's been no increase in provision. If we look at Arborfield of Barkham, we have huge building out there, some of which is already in existence and delivered. We are going to have another 4,000 houses not far away from there. It would be really helpful in your yearly report if you could tell us what each practice's current registration is and what you believe their capacity is, and what are the plans for including the additional, I mean, it's going to be maybe 10,000 houses in the next 20 years or something. You know, how are we going to cover those 10, 20,000 houses with modality not increasing in size and the other ones staying where they are?
Yeah.
Because, you know, I just believe that we're not addressing the key problem here, which is that, and when I look at the ONS census, which is only, and it was 2011 to 2021, so it's out of date already and doesn't include loads of houses already, but the population of Wokingham increased overall across the whole borough by 11%, but in the age ranges 50, 60 and 70, increased by 43%. So speaking from my own personal health, I know my health got worse, considerably worse in my 50s. So, you know, when I was 15, I had no issues, or when I was 25 or 35. So with a 43% increase in our population, an ageing population, I feel that there is a significant load on the GP surgeries that is not being fully recognised. That's why I've been asking the CCG 6 years ago for what's your capacity, what's your capacity plans, what are you going to do in the future? And I used to ask a very nice lady who then left to go to Devon because she was cracking up with the questions I was asking probably. But I really want to understand how we are going to plan for these thousands and thousands of houses, bearing in mind that I would argue that the population, certainly at my surgery, thinks it's already overloaded. That would be the first question. I think you've kind of gone into a huge amount of detail about the head count and where they are and everything. What I don't get from that is a budget per person. So I know.
That's on a different page, so could we do the first?
Sorry, I thought this was all questions.
Yeah. Well, we've only got to this page. Do you want to do, are you happy to do that?
I'm happy.
Yeah, I mean, so I wanted to ask a question on page 10, which is, we've got books, Oxfordshire and West Berkshire. Where's Wokingham? It's disappeared on page 10. Fell off at the end.
What's the title? Do you mind telling me that?
Workforce. ARRS, utilisation.
ARS, yeah, additional roles reimbursement scheme.
Yeah, that there isn't, but there isn't Wokingham.
Berkshire West encompasses
It's everything,
Woking,
yeah.
West Berkshire.
Okay.
Yeah, it's some data we can't break down to local authority area. That is one of them.
Okay. And then we move on to page 11, where we see the GPs and the nurses per 10k of population, which we are the lowest across those groups. I mean, my understanding was from a high-level presentation made by the ICB was that Wokingham had the lowest NHS spend compared to anywhere in West Berkshire, Oxfordshire and Buckinghamshire. That I'm sure there was a figure presented which said, you know, it was, I think, £4.17 per person. I think that has probably got something to do with page 11, where we have less GPs and less nurses per 10k of population. And I would argue that having less nurses and less GPs than anywhere else indicates a budget problem. And secondly, it indicates a capacity problem, which is why I'm so interested in understanding the capacity and the current number of registrations for each one of those major groupings, like modality, etc. Because if we say, 3 years down the line, okay, we've now, because of further government diktat, got to build another 2,000 houses next to Crowthorne, then how will modality cope with another 4,000 people on the doorstep? It won't.
Yeah. So shall I respond to that? So
Yeah.
absolutely, the number of patients that are registered with each GP practice is nationally is available. You can log on and you can find that information. We can certainly make sure that we provide it for you. And apologies that it wasn't in this pack. So when it comes to modality, which is Wokingham Medical Centre, then yeah, they are one of our larger practices. We're currently working with them at the moment about how we can try and support releasing of extra unutilised space they have in the surgery to be able to register more patients. We are also working, we have an estates team within the ICB who are working with developers around the growth in housing and population there will be in the Wokingham local authority area. So we know where the pressures will be. We are talking to them about what are the best solutions, recognising the financial constraints that there are. Yeah.
I think if we got some basic information from your estates team that you could present, just headlines, that would be helpful,
Yeah, yes, yeah. I'm sure we can send something back to you on those.
Can I just pick up on the workforce? So just to let you know that this is actual GPs on slide number 11 and nurses. But if you look, so we are slightly lower for the nurses and the GPs, but the slide before is the additional roles reimbursement scheme, which is your physios, your pharmacists, your dietitians, all the other ones. So a practice will decide what their staffing levels are. Some may opt to have an extra GP, some may opt to have 2 pharmacists. Being a pharmacist, I hope that happens. But, there's going to be a mix there. So the makeup of the practice are going to be different. So I think it also needs to be taken into account that it will be dependent on what the practice is made up on in terms of who you'll get to see.
Yeah.
Then when we next look at these figures, can that be taken into account? Because that somewhat changes how we look at this.
Yeah, we
if
can
we've
add
got
narrative on
physios
there.
and
Yeah.
whatever
We can add
included in
narrative
it.
onto the reports. Yeah.
Okay, so that it covers, if it could cover all staff.
Yeah.
Um,
Yeah, I'm not sure if it's broken down. We'll add some more points on actually. And then,
Yeah, I mean, definitely we can convey the point that Sanjay's making.
Yeah.
Every practice will model its workforce based on the needs of its population, and no one practice will ever look the same. Yeah.
But we've got practitioners, all sorts of things nowadays, haven't
Yeah.
we? Yeah. Naggy and then Mike.
That's better. So in the last 10 years, we've got massive estates being built. So how many new GP practices have been built? That's the first question.
I don't know. I would take, yeah. So there has been additional extensions added to practice. I don't believe we've built a new practice in Wokingham since the Wokingham Medical Centre was built.
How many have been closed?
So there has been some, no practice is closed. There's been some, small branch sites that have been closed, and they've been working more efficiently across the larger estates that they have, but we've not closed any GP practice that I'm aware of.
If none have closed, how many have expanded?
So I wouldn't be able to tell you off the top of my head of all the practices there are in Wokingham. We would have to, so if we're going to come back to you on what our estate strategy is for Wokingham, that would be part of it.
Chair, one last question. I have a last question. Yeah, the strategy would be good because I know you guys are coming here presenting, but it would be good if you can come back regularly and keep us posted about, this is how it is, this is what we're going to do, because we want to see more improvement in this entire area. Because
Absolutely.
whenever we are at the doorstep, this is one of the key things that, especially with the elder residents, they're struggling a lot to get the appointment or, see a doctor. And that would be one of the major concerns on top of the list. And especially in my ward, in Norris, which is literally in the town, we have Wokingham Medical Centre, which is, I think there are about 28,000 that are registered at that practice currently, which is a huge, huge number. And the next one is Woos Hill, because anyone in my ward are being referred to Woos Hill because Wokingham is too busy. And even with Woos Hill, there are 16,000 or more. So any given day you call them, the waiting time is 40 minutes in the morning, a minimum of 40 minutes for both of them. Okay, and I think being a developed country, I think that is appealing to be. And there's a surgery, Burma Hill Surgery, and they don't have a consultant or a GP, I should say, and it's been ages. And we don't know when there will be a new one. So currently all of them are just waiting, and some of them are going to Wokingham Medical Centre and being told you have to go to Woos Hill. So it's a bit chaotic. It's not as simple as how this report looks.
Yeah. So I have the response from the Burma Hills, and I'll share that with you. So what I would say, Chair, if we know what questions people wanted to raise, then we could have done more on the estates. So we focus on access, I'm afraid. So I haven't been able to answer the questions you've raised, but it was flagged, the Burma Hills was flagged, and we do have a response. And if I could get online, I'll be able to tell you what it is. But I'll definitely share it with you.
Mike?
Yes. I just wanted to build on what Councillor Mather said. So not only have we got an awful lot of building going on around the southern development area, we have planning applications in for 2,800 houses and another 490 odd houses for the Hall Farm area. And I'm part of the planning committee, and I'm trying to work my way through the literally hundreds of comments that have been lodged on those two applications. They fall into 4 or 5 different typical responses. But a key one is, where are all the GPs going to go? Where are all the staff to man these GPs going to go? So one of the biggest problems is there doesn't seem to be any joined upness visible to the public between planning applications, planning strategy, and NHS provision of services strategy, particularly at the primary care end. So it would be really good if your estates team could come along and talk to us and understand how they work with developers to address these sorts of things, because it's completely opaque to the public.
Yeah, no, we can ask them to attend and talk about the work they do to plan for future primary care estates. Yeah.
Our planning team also do work with Wokingham Council planning team. Actually, they've got good links in there as well.
I've no doubt. The fact is, it's completely opaque to the public. So all they see is huge numbers of houses being built here and here. Can't get a GP appointment now. How on earth is it going to happen in the future? So either it needs to be moved into the public realm, or it needs to be better understood by the likes of councillors, etc., so we can tell the public. Please.
Are we ready to move on to modality on page 12? Mike? He'll be your best friend in a bit.
You've got pages for each of the GPs or the GP groups, which is great, it's interesting. There is some oddity in I don't quite understand the syntax of the words in the bubble there. There seems to be a missing full stop and a bit of text. But what I was actually interested in was looking at the staffing numbers, so the headcount and full-time equivalents by job role. In the first one, and in all, the role of other is the biggest number, and in all the others, it's the second largest number of employees. My understanding, having Googled a bit, is that this additional, the ARRS, I can't remember exactly what it stands for, that adds another 17 roles, although actually, if you look at the NHS site, there's actually 18 roles described. There are 15 roles described here other than other. So this other is a huge group. Does it break down, or is it just really sort of lots of individuals doing one job? I'm really struggling with this as a useful piece of information.
Yeah, no. Do you know the answer to that?
Yeah,
Sandy?
no, I don't. I mean, I think all of the data we've got here comes from a national database. So it just breaks it down into some of these.
But it does say head count
Yeah.
is so it's actual people is the blue line, and then so other, it will be individuals.
That I understand, but you've got 15 roles described here, which there are full-time and numbers of staff and the full-time equivalents. The ARRS adds 17 roles, many of which are not here, so physiotherapists, senior pharmacists, junior pharmacists, etc. Paramedic, so some of these are here, some of them are not. But this is a huge group of other. It's a massive number of people doing something in surgeries that we've no idea what they're doing.
Noted what you said.
Is that information actually available?
So GP practices do a workforce return on a regular basis to NHS England, and NHS England define the categories and obviously have a category which is other, and the practices will define who goes in which category. We can certainly feedback nationally that it would be helpful to expand the other, and we can do that.
Okay, thank you. Alison?
I think possibly Adrian made this point a lot earlier, but I'm not quite sure how each of these pages about each PCN is supposed to inform us without telling us how many patients are registered at that practice, so we can put it into context.
Yeah, I agree. I looked at
So
it
what
earlier.
was the purpose of providing this for us?
Yeah, so this was just to illustrate like the workforce that are out there, actually to see the differences. But I think one takeaway, we'll definitely put list sizes in there for you. So you can see, you know, there's 15 GPs for 25,000 practices or whatever. So we can amend that for you.
Or a rate per thousand, so you can make some comparisons. Yeah. No, I don't disagree with that comment. Yeah.
I think as it is, that information it begs more questions than it answers.
Yeah.
And so if we could move on and touch that in a deeper way next time, perhaps. I think we move on to patient experience on 18, if we ignore the modality things. There's quite a lot of interesting information on there. So does anyone want to ask any questions, or Sam, do you want to say something first?
So I would only say that it is a national survey, and the results are therefore produced for us. I know there's been comments about that the figures that we're presenting don't necessarily bear relevance to what experience is, but we can only present back to you what the national survey has told us. What I would say that we've now, so this is 24-25 survey results that have been presented here. So that would have been a survey that was published in June 24. There's been the June 25 survey that has since been published, and nationally and locally. There has been improvements in satisfaction rates, but again, it doesn't seem to correlate to your experience that you're conveying this evening. But we do work with practices that have poor performance rates in the survey, and quite a lot of them will undertake in-house surveys to see what the patient experience is, so that they can address it with their PPGs, their patient participation groups.
Is there anything that comes out of that work that you do with individual surgeries that would help us to better understand what the local position is?
So at an individual practice level, yes, but we don't necessarily pull that together to be able to present a wider picture, no.
Mike?
Looking at the graphs on page 19, particularly the access by phone, West Berks and Oxford are way out in front. And I'm just wondering, is this related to the number of staff per 10,000 patients, or is there some other explanation of why?
Yeah.
I mean, they're also out in front on the overall patient experience, but not by quite so much. But it's very obvious. They're a long way ahead on access by telephone.
Yeah.
Why?
So we did do an exercise to try and done some sort of correlation work between responses. So we looked at, what resulted in practice getting good results for telephone access or getting good responses for overall experience of their practice. And the correlation that we found was about how quickly they were seen and how friendly the staff were. That was the only correlation that we could make. Not necessarily more staff. Well, it was how welcome they felt by the practice, how friendly the staff were. Whether that equates to they have more staff, I couldn't comment.
Alison?
You've just given us one answer to the question. So when people were asked to access by telephone, so 53.7% of people in Woking said it was very or fairly easy. Does that mean 46.3% said it was okay, or it was really difficult, or fairly difficult? Do you see what I mean? It feels like you're picking what to show to us here.
So
I mean, it's like also in the other one, people, so we've got 77.7% said their experience was very or fairly good. But I think what would be more telling would be if you understand the percentage of people who said, well, it was satisfactory, and the percentage of people said it was fairly poor, and the percentage of people said it was terrible. But
okay.
Do you see what I'm saying?
Yeah,
if you're going to present to us...
I do understand. So, we have presented a positive position.
There shouldn't be any spin on this report. We should have a transparent picture of the results.
Yeah. So the assumption you could make is exactly what you've just done. So if 60% were satisfied, 40% weren't. And there is, all the national survey results are available online. And you can look at that at individual practice level and at the ICB level as well. But yeah, we will take it away that if we were to produce this again for you, that we would put the positive, negative and in between feedback into it.
I think that would be quite helpful because it would give us a balanced view rather than just a partial view, and we've all interpreted it in a different way.
Yeah.
And so that would be quite helpful. Hopefully it doesn't create too much work.
It's all data that is nationally produced for us. Yeah. We are just presenting it back to you. Yeah.
Do we have any more questions on this report? Can we have a... What a surprise. Go on, Mike.
Just a note on working in response. On page 21, second point down, it talks about LVLTS. Looking at the second we're looking at one people tend to ask practice with them, including talking about stuff to GPs, nobody tell me what it is. If you Google terminology on it, doesn't usually use for this surprised that nobody in my practice this I was surprised that really it was all here and said GP practice participation in the entire patient cohort interventions.
So that is saying that all practices use segmentation are segmenting their patients so that they know the risks. So it links into the online consultation tool. And it also supports reception staff. So if you've been segmented as red, they will maybe prioritise you differently as if you've been segmented as green, because that assumes that you're generally normally well and you might just have an episode that you're phoning on for that day. So I can't comment as to why the practice wasn't able to explain it to you, but we can highlight to practice the importance of being able to explain to patients why they're using that tool and what it means for them when they look at their record and see how they've been classified. Yeah.
Thank you. Adrian?
On page 23, the pharmacy first rates, I see Wokingham is significantly higher than especially Oxfordshire and West Berkshire. And I would look at that and from, anecdotal stories say that perhaps one reason Wokingham is higher than anywhere else is because people think it's so difficult to contact the GP, I'm just going to go to the pharmacist first. So, although that's a positive thing for Wokingham, I think, and there are a number of people that have told me, yeah, I'm using this pharmacy first service because of the GP service.
But also you could say that the acuity of why their condition means that the pharmacy first service was relevant and they should be using it. But I get the point you're making.
Yeah, I mean, I agree with you. Certainly it has some weird restrictions on, if you're under 16, we can look at your ears. If you're over 16, we can't look at your ears and things like this, which none of the anecdotal people that spoke to me could understand.
I'll pass to our pharmacist.
Yeah, so it's a national scheme. And when this scheme was developed 2 years ago, I think it was 2 or 3 years ago, the specification that came down was that restricted for reasons probably were built, outside of my knowledge. When a pharmacist is able to give out medication via this sort of pharmacy first scheme, it's under what's known as a patient group direction, which is the legal authority to allow pharmacists to prescribe, because they're not prescribed, but some are, but the community pharmacists aren't. Those restrictions, there's an inclusion criteria and exclusion criteria, and it was deemed by central government and NHS England that for certain ages it was more riskier to do it for certain age groups, and that's where it all came from. But I agree, it's confusing, actually.
Yeah, the last Bob meeting I went to, they said that guidance is being revisited. I don't know whether it is or not.
No, I don't think it's been changed yet. I think the scheme is still here.
So we were presented that you were going to be giving a report on GP access and performance, and it's great to hear about patient experience, but I'm not quite sure there's a lot of information about GP performance. Now, I know it mentions the CQC quality ratings, and all Wokingham practices are rated good. However, having looked, Parkside hasn't been rated since 2017, New Wokingham Road since 2016, Brookside since 2017, Finchampstead since 2019, and they're supposed to be every 5 years. So we seem to be relying on quite old reports on, I mean, you simply stated all working practices are rated good, which is good. I mean, it's a shame none of them are outstanding. But, I mean, you're either good or requires improvement, are you, when it comes to CQC?
So you can be outstanding, good, requires improvement, inadequate.
Yeah.
So we work, so CQC have had capacity issues and looking at their processes themselves. So met with them today actually, and their strategy at the moment is to start visiting practices that have not had a review since 2016. So they are working through it. What I would also say is that the ICB has a primary care quality dashboard that has a number of indicators in it looking at the performance of GP practices. So it'll look at their how they've delivered the quality outcomes framework, and in that it will be looking at how they're treating hypertensive patients, how they're looking at treating cardiovascular disease, looking at cancer patients. It also includes indicators around like immunisation rates, cervical screening. So we have other tools that we use to look at performance, and as I said earlier, we do this programme of practice visits. So if we have concern about a practice performance, we will be talking to them about it.
Okay, so I think that information about GP performance is what we would like to have heard about.
Yeah.
Obviously, perhaps not by each practice, but for Wokium,
we could do
hitting
it
all those targets. That's what's really important for our residents. And what's important for our residents is what's important to this committee.
Okay, so I mean, I gave my reflections back to you, if I'm able to. Is say if I known that first, I would have done that. Yeah.
Well, the title on the agenda was GP access and performance.
Okay.
I mean, I know we've got information about dentistry and pharmacy, but
Yeah.
yeah,
Okay.
when we bring this back next time.
Adrian.
I've got one further question, sorry. On page 22, which is dentistry. So if we look here, we see we have these budgeted UDAs, and we had this long discussion with Richard, whatever he's called, I've forgotten his name, and that's sort of the envelope, the restricted envelope that the dentists have to deliver into. And if I look at the figures, we have an astonishing percentage of delivery in Berkshire West, which is 99.49%, which is basically 100%. In Oxfordshire, it's 92%, Buckinghamshire, 97%. My understanding of that is that Berkshire West has no capacity, that we are right at the edge of the envelope, whereas Oxfordshire has 8% capacity. Would you like to comment on that, or?
Yeah.
You can.
Yeah, I mean, I'll have to find out information on that actually, because it's dealt with by our another team. I thought our dental commissioner had come to this, I think, 6 months ago or something, was that? Yeah, okay, we will find out.
If I could just say on dentistry that there is some good news. Sanjay's smiling because he's helped very much the planning application for a new surgery in Woodley, which has taken well over 6 months to get through. And I'm very grateful to Bob and the ICB for intervening and trying to push things forward. Without it, goodness only knows how long it would have taken. So good news, more capacity in Woodley. Any further questions? Thank you so much. I think you better go down to the pub now.
And we will, maybe I can work with you, Councillor, actually, in terms of what you need, and we will produce it. It's really hard to gauge, and I think what we try and do is one report across Bob, and then when we go to the different costs, we get different questions. So we don't know, but we can work with you. But just to bear in mind, obviously, the ICB is going through a restructure at the moment, so we will form Thames Valley ICB as of April the 1st. So we will keep you informed on who's there, but we don't know the personnel that it may change in the future. So we will keep some notes for you.
Yeah, very happy to work with you on that, Sanjay.
Brilliant, thank you.
Thank you very much for coming. If we could now move on to agenda 52. You're taking that? Caroline, could you introduce yourself?
Thank you. There we are. Thank you very much, Chair. My name is Caroline Vass. I am the Interim Director of Public Health in Wokingham Borough Council. I've taken Jyoti's place. You may remember Jyoti. She's moved on now, so I am now here in her place. So thank you very much. I'm going to hand over to Gary, who is going to give this presentation. So we will assume that you've read the paper, and what he's going to do is give you some of the key pieces of information to update you on the progress with NHS health checks, which I believe was the request that we were asked to bring. So Gary, over to you.
Hello. Thank you very much for having me at the HOS meeting. As Caroline just said, I'm going to give a sort of a fairly brief update on the NHS health checks. Just to let you know, I've been from the presentation that I've prepared hasn't worked. It's not going to work. So I'm just going to ad lib through it. So please bear with me. But we'll send the slides out afterwards. So if there's any clarifications needed after this as well, then just contact me, please. All the data's in the paper. It's just a summary of slides, really. So my name's Gary Hutchings. I'm the Senior Public Health Strategic Commissioner for Prevention and Health Improvement. I'm new addition to the team, as is Caroline, of course. So speaking briefly through NHS health checks, local authorities have a responsibility to offer NHS health checks to 100% of the eligible population once every 5 years. So people between 40 and 74 that aren't already plugged into a pathway for cardiovascular disease. And so people are due to be invited once every 5 years. Our eligible cohort is just over 56,000. So over 5 years, so that's about 11,208. I know that figure quite well per year. People that are the eligible cohort for the Wokingham area. Basically, the health checks program is a risk assessment for cardiovascular disease. So within that, it would take information on blood pressure, cholesterol, alcohol, smoking, body mass index, and lifestyle, just to then formulate what we would call a Q risk, and then from that there will be on referrals to other pathways potentially, or multiple pathways. For example, working with a social prescriber, or then forwarded on potentially to the GP. So, for example, from our community wellness office so far, about 23% of those people have been seen for an NHS health check have been referred through for further examination by their GP. In terms of the current position at the moment, the performance that you'll see, I believe it's on page 4, for working in NHS health checks, which is that sort of scatter diagram, is if you look through, I've got a slide on here which you can't see, but Wokingham's all the way down to the left. It's very, very tiny in terms of the printed copy of it. So we're certainly an outlier in terms of performance in the southeast and across the country. So there's a few different offers for NHS health checks at the moment. So that is through the GP practices, which is overseen in public health. All the offers now, as of 8 weeks ago, are under the public health team. Previously, the community wellness offer was under the integration team, so it's all been brought into one place now under public health. So that's funded from the public health grant. There's also the community wellness offer, which is funded by the Integrated Care Board. So that's into more of a targeted approach to NHS health checks. And also alongside that, there's the opportunistic NHS health checks from Royal Berkshire Hospital as well. Historically, though, in Woking, we've had a relatively low uptake for a variety of reasons. So in terms of what we're doing about the performance at the moment and the uptake, there's a lot. In terms of looking at that and just looking at that scatter diagram, seeing where we are, we're not necessarily in the position where we need to make tweaks to our offer. So one of the things that's been put in place is the Public Health Senior Strategic Commissioner, myself, has been appointed a few months ago to look into this and really build the stakeholder engagement with this programme and explore the issues, problem solve, and get as many voices as we can to remodel our offer here and really take into consideration some of the things that we've already been discussed today in terms of using the NHS app for invitations in the future for identical, but also taking into consideration that's not going to meet everyone in the population. What can we do to mitigate that and have more of a holistic offer and more of an outreach offer around that? So there's been a lot of collaboration around this as well, especially with the GPs, actually, I would have to say, in the short time I've been here, to really combat that and make sure we get out to everybody that we need to and remove barriers. So, yeah, we're working really hard at the moment to revise a model of delivery to improve offers to residents and especially looking to start the new project as of April 2026. We'll continue to consult with partners and stakeholders, finalise a proposal for internal processes as well, and that will be what the plan is going forward. There's a lovely slide of a Christmas tree here, which you're all missing out on. Sorry about that. It took me a while to find out, but you'll see it when we send out the slides. And I'd welcome any questions that anyone has got.
Can I just add to that? Alongside employing Gary and revitalising the model, we've also increased the funding from the Public Health Grant to help deliver a revised model. So that's what Gary's talking about. Will be piloted from April 2026 and then evaluated so that we can understand the outcome of that.
Mike and then Alison.
Thank you. Thank you, Gary, for your presentation. I assume then that all this health care checks is actually based around the Q risk assessment process, or the Q risk 2 process. So according to a paper in the BMI, the Q risk process is overly pessimistic, and it's particularly overly pessimistic with age. So as you age, then it's forecasting more dire consequences than it does. There's been an analysis of over 400,000 patient records. So Q risk seems to be overstating an issue, and I'm a bit concerned. If I look at so you said there's 56,000 people in Wokingham that are eligible. If I look at your graph at the bottom of page 6 of our report, where Wokingham's right down in the bottom left-hand corner, yes. If I've interpreted that correctly, we're only offering around 8.5–9% of eligible people a health check. And if you look at the vertical axis, about 8.5% of the eligible people are taken up. So that sounds like, of the people we offer a health check to, almost everybody's taken it up. So why are we not offering more than 8.5% of the eligible people a health check? Do you follow my logic?
Absolutely, yeah, and that is, it does appear to be that way from the statistics, and we've done a lot of work on increasing the uptake from the surgeries. The community wellness offer team as well have been really working tirelessly to go out into the community and really target people in particular communities. From into deprivation, but also from particular cultural groups as well. But yeah, I mean, the evidence is there. If people were invited to an NHS health check, they come. So that's why we've really been working on the methods of the invitations. Getting the new model that we're working on as well is very much focused on a much bigger volume, but in a very holistic, getting those invitations in a very holistic way. For example, you know, telephone follow-ups, emails as well for people that aren't engaging at the moment. So yeah, if the evidence is there that if people are invited, that they tend to attend. But also there's quite a lot of evidence for opportunistic. A lot of the ones we're offering aren't invitations, and they're just opportunistic people that are caught in the surgery on that day as well. So it's about having a varied offer.
Sorry, it's kind of a supplementary. So are all surgeries only addressing the once every 5 years? Because I have a health check every year and have done for some time, but I don't think my John Hopkins score is relatively low. I'm a low risk. So are some surgeries doing better than others?
Not all surgeries have signed up to the NHS health checks programme thus far.
That might explain why we're not offering them at all.
And that's one of the big elements of the partnership working, and that real collaboration to really problem solve what's going on with that. We're making good progress with that.
Alison.
Right, it's a pleasure to meet you, Gary, this evening, and Caroline, and we really appreciate you coming here in person. However, I kind of feel like you're presenting this too early. The vast majority of the paper is telling us about how awful it's been, and we're really doing a very poor job here, and that we've got to make changes. Completely agree with that. But you're not, unless there's a lot more in this presentation you were going to show us, you're not able to tell us too much really about how exactly we're going to change this. And then the next steps are to implement from April, which is not far away. So you're not going to have time to come back to show us the proposed model of service. Is that right? Yeah.
We were just asked to give an update. The timing wasn't in our gift, so it was identified that NHS Health Checks is performing badly for Wokingham. We were asked to give an update. The update is this. It isn't the best timing. I agree. We are progressing. We're quite a long way down a revised model at the moment, so that can come fairly soon to HOSC, should you wish to see what that looks like. But the aim is to get a universal health check offer out to all the eligible population on a 5-yearly basis, with that onward referral. And Gary's been doing lots of work with practices to try and get that really embedded.
Okay. And just to follow up, the proposal to work with the voluntary sector to coordinate referral opportunities, could you just give us some examples of which voluntary sector partners you're planning within your model?
Already within the community wellness offer, we're working with Involve, and they're contracted with us to provide the social prescriber and part of the database as well. So also the Voluntary Action Centre in Wokingham. We've been working extensively to learn from what's happened so far, but also get that feedback about what we can do to really improve things going forward, because the voluntary sector are a huge part of the way forward for us. And even looking at, we're really also trying to make this future proof in terms of the NHS plan as well, so we're not going to have to come back and revisit this in a year's time, but also working out what have we got in working, what innovations can we bring in here, and what's relevant to us, rather than looking at what's going on, take best practice from other places.
So this is going to be a rollout across the entire borough at the same time, rather than targeting the areas where we know that there's residents perhaps more at risk. I mean, as Beth knows, we had a presentation last night about the new family hubs, which was very interesting to show some statistics by ward of health conditions, and you could see that there are parts of Woodley and parts of Wokingham that have been picked out as being more in need of help than other parts of the borough, but this is intended to be a absolutely blanket rollout.
It's very versatile, what we're looking at in terms of actually getting that targeted work through in a really holistic way, as well as the universal one, as we've pointed out earlier on. If we get the invites out to enough people, the numbers will go up. But we're working, actually, I'm working with the team in terms of the family hubs and also the neighbourhood health web, and also aiming towards the neighbourhood health hubs as well, because in the NHS 10-year plan. Really trying to make this future-proof, collaborative and genuinely inclusive of all the partners and stakeholders involved, including, of course, patients.
If I could just follow on from what Alison said about the hubs, it would be very useful as local members if you could tell us when you're working in our ward. I've got quite a big patch in my ward that is struck by several things, not poverty, ill health, loneliness, all those sorts of things. So it'd be very useful if I knew, and if Alison's got a bit in that ward or any other of us, it would be a great help to us in what we're doing to help you deliver that. Thank you. Adrian. Adrian, please.
I just want to say any help gratefully received in terms of getting our message out and getting as many voices heard as we can possibly get. Yeah.
Firstly, I want to say thanks a lot for coming, and thanks a lot for not glossing over or painting a better picture than it really is, because you know, this is the result we expected. And these comments that I'm going to say now are not directed to either of you two, but clearly the performance over many years has been absolutely pathetic. And this tallies with the recent ICB presentation that we had, which was that Wokingham was an outlier for prenatal and postnatal care as well. So we're not making those checks. We're not making these checks. You know, we are absolutely failing our population at the moment. And thank goodness that there's new people in the room and that you're invigorating and wanting to change the situation, which is really overdue for change. I wanted to ask you the first question. You said something like you're going to use more of the budget than has previously been used, or something like that. Just let me, one of my hobbies is reading accounts. And if I read the accounts for this place, we get a grant of 5.86 million. If I read Windsor and Maidenhead, it's 5.2 million, which Windsor and Maidenhead is a smaller population than ours. In Devon, which is a much bigger population, of course, their budget is 36 million. So a completely different level of budget with a completely different level of population. But I wanted to understand your statement concerning budget, because are you implying that some of the budget in previous years wasn't used?
Thank you. The public health grant is a thing of beauty to behold, and it's calculated, just to let you know, it's calculated on population, it's calculated on historic spend from before we were even in local authorities, and there's an element of need put into that as well. So it's very complex to kind of unpick. In terms of the budget for allocated to the NHS Health Check, it's not that it was underspent before, it's that we allocated a very low amount to spend on health checks. And what we're doing now is we're increasing the amount that we will be spending on health checks in order to be able to deliver a better, more comprehensive offer. So the aim is that it will be a universal offer across the patch, and we will be funding that in a slightly different way, and we've increased the funding in order to deliver that. One of the things, yeah, no, that's your question.
So, you know, my question as a sort of amateur accountant is always, if we were spending peanuts before on these checks, what were we spending the money on?
Well, what we used to do, or what we are doing kind of at the moment, which we're going to be changing, is we would commission GP practices to undertake a check, and we would pay them on a per check basis. We would pay them to send out an invite and then undertake the check. There are a couple of things failing there. We weren't paying them enough to make it worth their while, really. We hadn't managed to convince them of the priority or need for NHS health checks, so it wasn't seen as a priority for them. And we haven't really got to grips with the onward referral to those lifestyle kind of activities that will help reduce the risk.
I mean, you're talking about the bit that we're going to spend in the future. Last year, what did we spend all the money on? If we've got 5.8 million, which was the figure last year, right? And you're saying we spent a tiny fraction on health checks.
Yeah.
What was the majority of the budget spent on?
Oh, I see. I'm sorry. Sorry, I thought you were talking just about that element of the budget that we allocated.
We've got 5.8 million. We spend, I don't know, 200 grand on health checks or something. What about the 5.6? Where did that go?
So I've been in post 3 weeks. So let me just remember, because I am doing some work on the budget. We spend about £1 million on staff. We spend about 2 million on the 0 to 19 programme for children and antenatal newborn kind of health visitors, school nurses. So it's called the 0 to 19 programme. We spend about just under 800,000 on drug and alcohol treatment services. We have a health protection responsibility. So within the public health grant, we are required to use that grant in certain ways. So there's the smoking and vaping services as well. What I can do is bring back a breakdown to HOSC, if you're interested in that.
That would be really helpful. We can always revisit things, but it's good that you're increasing the budget for checks, and I think everybody in this room would agree with that. But on the flip side of that, you're going to cut spending somewhere else unless you get more money, and the assumption is you're not going to get more money. So what else next year is going to slip a bit is what we would be interested in as well.
I can tell you that now. So one of the things that I'm actually doing is undertaking a restructure within the public health team, and there are a couple of posts that we currently have, historic posts, that are more appropriately funded by the ICB. They're not delivering population health outcomes, delivering clinical outcomes. So we're looking at those sorts of elements, and I'm exploring where we can do that.
Let's call that optimisations, but optimisations we're all keen for, makes sense. Now, down to brass tacks here, this council spends 190 million a year. Yeah. The next 3 years, we've got 47 million to lose from that. Yeah. So is that going to affect your funding, or will your funding be ring-fenced? It's ring-fenced.
Our funding is ring-fenced.
That's very good to hear. Thank you for that.
And it comes with certain criteria. So we have to spend it on certain things, and health checks is one of those things.
Yeah. Thank you very much for those answers.
Is bringing that back to the next meeting too soon for you?
When is the next meeting?
January?
On the 19th, I think. 2 weeks. So,
No, that's another one.
Is that exactly?
That's next to
January.
28th of January.
I'd rather you have proper time to do it.
I'm going to say, let's go to the next one, because I will have the next year's actual budget at that point, and then I can tell you what the 26, 27 position looks like, rather than tell you what we've been doing.
That makes more sense.
That makes more sense, a better use of our time.
Alice, please.
Alice, please. Your question.
Thank you, Chair. Hello, Caroline. Welcome to Wokingham. And Gary, we've met. One of the things I'm quite keen to find out, just to introduce, I'm Alice Clifton. I'm the lead officer for Health Watch Wokingham. Gary, I'm keen to find out whether you can showcase a breakdown of all the cohorts that have had the health checks, because that would be quite good to understand, to find out where the gaps are and how you are planning to engage with those gaps.
A breakdown of the cohorts in terms of statistics
Yeah.
now.
Do you have?
I can tell you in terms of the statistics for now. That's not something I had prepared for this session, but I can definitely share that afterwards.
Yeah, it'd be nice to know which are the cohorts that you've engaged with the health checks, and then where is the gap?
I can give you, well, in terms of some general information. For example, the team have been out in 37 different locations. The community wellness offer team have been out in 37 different locations across the community. They're going to be covering a local mosque over the next couple of weeks on a weekend to increase access. They've been facilitating clinics all over Wokingham and in certain targeted communities, also stepping up, for example, putting clinics in the drug and alcohol service, Salvation Army, so homelessness, yeah, getting a really as much of a spread and getting out to those communities as much as possible. Certainly in terms of what we're looking at in terms of the new model, we want to be doing a lot more of that and really getting through to people that maybe aren't accessing healthcare at all as much as we possibly can. I know we've spoken about that a little bit, Alice, before when we met last week. In terms of the plans going forward, yeah, again, it's more of that, and in terms of engaging people from across the population that aren't accessing healthcare, it's all very well. In terms of what you were saying before about sending invites out for people that do access healthcare, that are concerned about their well-being, but we really want to devise. We're in the process of devising a model where we can really get as firm a handle as we possibly can in a number of different ways of communicating with people to make sure we're getting these NHS health checks out, mobilising the offer as well in terms of mobile clinics, and really increasing the engagement to bring in the clinical interventions with the teams as well. So I've spoken to you a little bit about that, Alice, but we haven't formalised any the plans yet, as we've been saying, because we are in the process of doing that at the moment.
Thank you, Chair.
When you say across Wokingham, you mean Wokingham Borough, not just Wokingham Town?
Yeah, 37 locations all the way across the Wokingham Borough.
Thank you. Rebecca.
I'll just be quick. How are you going to measure success of this? So what are your goals? What do you want to achieve? You're starting at virtually nothing, 8%. Do you want to get to 50% of residents? And also, hearing the ICB say that they cannot enforce and make GPs do anything, how are you going to be different?
Stakeholder engagement, active listening, actually listen to what the issues are in a really open way, spend a lot of time in terms of face-to-face meetings, building up the engagement with the GPs as well. So what's the first part of the quiz?
So how are you going to measure the success? What's your target?
So getting, we're aiming for a model of best practice. We're aiming for to make sure that the quality of the NHS health checks are really consistent and really high quality. And in terms of the ongoing interventions that we have in terms of social prescribing, lifestyle, but also onward referral to the GPs as well, is really good. Our data needs to be better. We're really working hard on that so we can actually measure in a much more effective way.
Interestingly, just to keep it brief, how many people do you want to hit? If we're only hitting 8% of Wokingham Borough with these health checks, what's the national standard, what should we be hitting?
In terms of the national standard, of the average of per annum for engaging the eligible cohort is about 17.2%, but we're setting our sights higher than that with the plans that we've got, and especially with all the engagement and inclusion we've got, you know, and actually having two hands on the NHS app as well, and also the other ways of engaging with people. We're really confident. We're working really closely with OHID as well, and the ICB, and the surgeries and voluntary sector, and anyone else who's got an opinion or a stakeholder or yeah, a partner.
And to finish this off, unless anyone else indicates, Adrian.
Perhaps I ought to buy the house next to Mike so I can get annual health checks. Could we define what a health check is? Because I'm at Wokingham Medical Centre. I've been there for 25 years. I don't believe I've ever had a medical check, as in a comprehensive, you know, up and down, you know, etc. I do get a lot of automated texts from them saying, send your blood pressure in every few months, every 3 months or something. Is that a health check?
There is a defined NHS health check, as I mentioned before, about for people between the ages of 40 and 74. So you would go into the health check, answer some lifestyle questions. You would take, in some cases, a finger prick blood test that looks at cholesterol, looks at your blood sugar levels, blood pressure check as well, and yeah, answers general lifestyle questions. With that, they come up with a risk assessment, and then you get the onward referral. But there's a lot of the work that we've been doing is about going out as well and explaining how the different ways of accessing link together. There's been some confusion about that, to be fair. So some of the reports from the GPs there's been a little bit of a lack of consistency from the public health team, because of dealing with different people all the time, which is why my post has been brought in, so we can actually get some level ground and actually make some really progress with that. But that's a sort of whistle-stop tour of what an NHS health check is, because people also think they're beginning getting things they're not going to be getting. So we've got another organisation in as well, to Smart Health Solutions, that really work on the quality, and we're going to really focus on a training drive as well.
The next question is related to capacity. Now, I spoke to somebody in this authority, and we discussed, I think it was 350 refugees, where the Home Office wanted them to have medical assessments. And I believe that the Home Office, or whoever was responsible, went to the local GP surgeries and said, you know, you need to provide health assessments for these 350 people in this hotel. And all the GP surgeries politely declined. Then they were offered, I think, 150 quid a head. Then it started to happen, shall we say. But if we look at modality, as it's called, which is the one that I go to and my family goes to, it was mentioned previously, I think, by Nagy, that everybody is being redirected away from there because it's at capacity and has no capacity to do anything. So people are being redirected to Woos Hill, I believe. So for the 25, 30,000 people at modality, where there is no capacity, how is modality going to deliver any health checks and get to that 17% or whatever?
That is 100% a focus of the stakeholder engagement in terms of working with the GP surgeries and actually listening to what's needed, and coming up with solutions between us. And that's the key element of this. Sorry, Caroline. Yeah, so it's 100% in terms of why some of the health checks haven't been happening. Resource, space, as well have been raised. With some misconceptions about the model and confusion due to the lack of consistency in terms of who people we're dealing with as well. But yeah, it's a key element of what we've been talking about. And that's why we're working together to come up with a really sustainable solution.
That. I think one of the things that perhaps Gary hasn't mentioned is the GP won't be doing the health check. So it's not about taking capacity away from the GPs, it's about adding capacity in. So, the model that we're exploring, we're funding, the proposal is that we'll fund people to undertake that health check. And therefore, the benefit to the GPs is they don't have to do it. That's one benefit. The other benefit is the onward referral is that programme of coordinating those community activities that are out there, which has an additionality for the GP practices. So that's the kind of benefit to them.
That answer really helps and clarifies things, because I think the GPs would be thrown in the towel if you said, within the next 6 months, you've got to do 20,000 health assessments. They'd just say, no, thanks.
Sorry. I mean, that's why we have a poor outcome at the moment, is because it's been difficult to engage.
And sorry, back to my point I made in the previous discussion with Sarah Wise and Sanjay. I know from the Bob report that we saw 12 months ago, Wokingham gets less funding per patient than anywhere else. And in the end, whatever we say about anything, capacity is about funding. And if we have the lowest funding anywhere, we're going to have the lowest capacity. We're going to have the most stressed GP surgeries anywhere with the lowest funding. It just follows on. And, my question, not to you guys, but to the ICB is, why does Wokingham get less funding than anywhere else? When we know, and this arisen in this meeting tonight, that certain areas in the borough are very in need of healthcare. And you can see that in some of the outcomes. But anyway, I'm off my rant now. Thank you very much for coming.
Nagy.
Yeah, I've seen Wokingham Council is doing some sort of health checks currently. Are these in line with the 40 to 74 ones?
So the around in and around the council, it's the community wellness offer team who are doing the NHS health checks. So they're doing NHS health checks for 40 plus, but their particular funding from the ICB means they're doing from age 30 upwards for those particular ones. But that contract's being evaluated at the moment by the ICB. So yeah, we're working very closely with them on that.
Okay, just a couple of follow-ups. So let's say if someone's just turned 40, they should be notified by the GP practice, or how will they be notified that there is this health check which they can go take?
At the moment, it can be through the NHS app, it can be via text, depends on the GP surgery and how it's working, but that is something we're really digging into in terms of, we've spoke a lot at the beginning about, the very outset around digital exclusion, and that's something we really need to work with if we're going to get out to people in the population that to remove barriers. So, yeah.
Okay, thanks for that. I think the response have been helpful. Thanks for that. And just to Adrian's one, so once the check is done, the process is all streamlined, so which is good, because I was speaking to a few residents about this who are about 40. So they have done their test within the local Wokingham Medical Centre or somewhere, and then if something's picked up within those health checks, there will be continuous follow-up thereafter, either for 3 months or 6 months, so which I think is good, so that they know, yes, it's been tracked and taken care of. I mean, the overall goal is to protect someone's life and identify if there's any long-term illness they could catch up. So yeah, thank you.
Thank you, Nagy. Any more? Thank you very much for coming and telling us about what's going on. It would be nice if you could, update us in, I don't know what you think is an appropriate time.
That's the $24 million question, or $64 million question, isn't it? I suppose it would be good to come back and let you know that we've implemented it. But that is almost just a paper to let you know it's been implemented and what that model looks like. So perhaps it's something about 6 months in when we're starting to see the responses to that. So where are we? April, May, June, July, August, September. So maybe the beginning of Q3 next year. So September, October time.
If Madeline can work with you on those days.
We'll work, yeah, absolutely.
Yeah, and if something goes wrong and it doesn't work for that time, I'd rather have the right timing than an incomplete report.
Yeah, of course. Of course. Yeah.
Okay.